NHS staff flu vaccine uptake is at the lowest level since back in 2012. Expert says employees may suffer vaccine fatigue due to multiple COVID jabs. Frontline NHS staff offered free flu vaccine to help protect vulnerable patients. Comes as influenza cases up to 60 times higher this year than the last winter. Only 4 in 10 frontline NHS staff has rolled up their sleeves for the flu vaccine, the lowest uptake in a decade. Despite begging vulnerable Britons to get the jab amid predictions of a dire winter, the NHS itself has failed to convince most of its staff to do the same. Frontline medics such as doctors and nurses are offered the vaccine for free every year to help stop them inadvertently spreading the virus to any vulnerable people they encounter at work, like the elderly or cancer patients. It comes as hospitals face what has been dubbed a Flu-nami, with the infectious virus hospitalizing nearly 60 times more people this year than last winter. Analysis shows only about 4 in 10 frontline NHS staff have got the flu jab, as the health service is battered by rising influenza admissions. The result is lowest uptake the health service has seen by the end of November since 2012. NHS England data show an average of 1,939 people with flu were in hospital each day last week. It was up 67% on the 1,162 recorded the previous week and 57 times higher than the 34 recorded at the same point in 2021. Why do frontline NHS staff get a free flu vaccine? Health bosses offer frontline NHS staff a free flu vaccine every year to protect both the public and the NHS. The vaccines help reduce the chances of NHS staff becoming ill and needing to take time off work. This helps the NHS maintain the staffing levels needed to look after patients. If too many staff are off sick, the health service might need to cancel some elective services to divert staff to emergency care or use expensive agency staff to help plug the gap. The second reason is to help protect patients, particularly those for whom a flu infection could be very dangerous. As people can be infectious, i.e. able to spread the virus, before they start showing signs of illness, unjabbed NHS staff could catch the virus from a patient or the public and then unintentionally spread the flu to others. Whilst most people with the flu make a full recovery at home, elderly Britons or those with certain health conditions that weaken their immune system can need to go to hospital, increasing further demands on the NHS. As vulnerable Britons are more likely to encounter NHS staff as part of needing care, staff are offered the flu vaccine to reduce the chances of transmitting the virus. The lower than usual flu jab uptake among frontline NHS staff was revealed by Mail Online analysis of a decade's worth of government data collected by the UK Health Security Agency. It shows only 41.8% of all frontline staff in the NHS in England got the free flu jab by November 30th, the latest data available. This is the lowest annual figure for vaccine uptake among employees since 2012, when only 40.8% got the jab. It also represents a sharp decline from 2020, when 7 out of 10 staff, 71%, opted to get vaccinated against the flu. Broken down by group, only 41.8% of NHS frontline doctors and 44.4% of the health service's frontline nurses got the flu jab. It comes as the UK faces a surge of influenza cases that is piling extra pressure on a health service already besieged by rising winter demands, Strep A, and staff strikes. The latest admissions data for England shows an average of 1,939 people with flu were in hospital each day in the week ending December 18th. This is up 67% on the 1,162 recorded the previous week and a whopping 57 times higher than the 32 recorded at the same point in 2021. Although still lower than COVID, the flu figure was also a sharp increase on the daily average of 480 at the end of November. Professor Paul Hunter, a public health expert at the University of East Anglia, told Mail Online that flu vaccine uptake in frontline health workers was critical for not only for their health, but for the public's and the wider NHS. He said, "One of the biggest problems during a bad flu year is healthcare staff going off sick with the flu, and so staffing levels become unable to cope with demand on the NHS. The more healthcare workers that catch flu, the more likely it is that vulnerable patients become infected and so add to the pressure on health services because of delayed discharges or need for respiratory beds. He added that the NHS had generally always struggled to encourage most frontline staff to opt in for the flu jab. But Professor Hunter speculated another factor dragging down this year's effort could be vaccine fatigue from the numerous COVID shots NHS staff had been encouraged, and in some cases threatened, to have. I suspect some of the low uptake is down to vaccine fatigue, he said. How deadly is flu? The number of people who die of flu, also called influenza, varies from year to year. Flu is divided into different strains. Influenza A is more deadly overall, particularly for the elderly and young children, whereas influenza B outbreaks generally result in fewer fatalities. How many people actually die of flu each year in the UK is complicated because of flu and pneumonia deaths are often recorded together. It is estimated that in a bad season flu will kill 30,000 people in the UK. In the US, flu is estimated to kill between 12,000 to 52,000 people a year. Globally, the annual death toll is estimated to be between 290,000 and 650,000.